is Dewey Freeman. I was fortunate enough to be able to present last year, and Larry has asked me to monitor this afternoon. In looking at everybody that is going to be presenting, seems like we're moving into what I would call an I-thou relational process. I-thou means that everybody in the relationship is equal versus I-it, which is where we objectify others. So we'll be very much coming in from an I-thou place. I would like to introduce Dr. Krystal Tsosie. Did I get that correct? Yay. So Krystal and I had a moment to chat outside. And one thing Krystal shared with me was that she quilts, which is what this symposium, that's the name of this. The other thing that I thought was so friggin' cool is that she's a race car driver. So please welcome Dr. Tsosie.
Yat everyone, she'ekinachini, nishlito na kaidna epashichin, torichin tashcheto tazalana tashnele, Dr. Krystal Tsosie nishyat. Yeah, thank you so much for welcoming me here. I am so honored to speak here for the first time in the symposium. I introduced to you everyone I'm related to, honestly. Surprised you didn't know that or understand. So glad that the rest of this talk is not in Dinepazad. But I am always filled with pride whenever I say Dr. Krystal Tsosie in my language, which means I am Dr. Krystal Tsosie. But I introduce my ancestors first, because obviously they come before me, and then I introduce myself last. So thank you all. I'd like to first start off with a few disclaimer statements. One, that I am very honored situating as a genetic epidemiologist and bioethicist, serving as PI to analyze the first release of what could be the largest public data set of American Indian Alaska Natives worldwide for quite some time. I'm also co-founder of the Native Biodata Consortium, which is an Indigenous-led research nonprofit, which I'll talk about briefly. I also, from time to time, accept money from pharmaceutical companies, of which AbbVie is one. I'm surprised they keep paying me to talk to them, which you'll see why I'm surprised in a moment. And then I serve as on a clinical advisory board for a company. If you do not know who I am just an Indigenous Navajo geneticist, ethicist, somebody that's trained in data science. And there are not that many of us in the world. So when there are as few of us that exist, we get to specialize in everything. Everything related to health and medicine, which is my primary focus, expanding now into organoids and neuroethics, a blend of ethics and my past life as a tissue culture person. And then I also get to spend a lot of time thinking about data sharing, governance principles, and ethics in other spaces related to conservation, genomics, and also paleogenomics. I come back to Arizona State University after doing my first master's there, and now I'm so happy that I get to teach courses such as Biology and Society, where I get to create paper quilts with my students. And this is actually a picture from Science Magazine's feature on me. But this is actually something that I'm really happy that in the few years that I've been at ASU, that I've been able to, in the largest unit at this really large public R1 institution, create the largest Indigenous presence on campus with up to 12 people in 3 years. These number of students entrust me with their training. Thank you. And then the reason why I did not show up until this morning is because last night I got to provide Pendleton stoles to 4 graduates, a newly minted doctor, a master's, who's also the community engagement coordinator in my laboratory, and 2 undergraduate students I'm so happy about. And then after that, I threw off my robes and ran into a car, and then onto a plane, and then was whisked here. So I'm very happy about that. So happiness aside, I first want to talk about a vignette something that really is a story that impacts my family and also has impacted my journey and my decision to pursue genomics and medicine. So first I want to talk about this story. It is one of many in our creation narratives, and one in which we were told by Diendene, the holy ones, to choose between two powders, a yellow one for corn pollen and yellow for what we now call uranium. And when we chose, as enough people, the corn pollen, the gods nodded in assent for our choice and told us to leave the other yellow powder unearthed. So now we get to the rise and urgency of what becomes the nuclear age from World War II. And where is that uranium sourced? It's actually sourced from the Navajo Nation. And when this mining was occurring, many of these workers actually were working either underground or in open pit mines. They were told not to wear masks. What would then become OSHA would actually, when they did their safety inspections, only then were the ventilation fans turned on. And then even the knowledge that cigarettes leading to lung cancer, there were some preliminary studies and murmuring, and what they ended up doing, the employers encouraged lung miners to actually take up smoking. So that years later, when the miners started dying from heightened rates of lung cancer, they instead blamed the smoking as opposed to the uranium link. So that just impacted our workers, our men, but our women and our children also lived in camps close by these mines. And oftentimes these open pits were left open, fallow, gathering rainwater, would irradiate other nearby sources. We're talking about a foundation of sedimentary porous rock and this uranium mining going into our aquifers and our systems, but it was actually stated that when radiation badges were given to our community members, that they never actually returned the results of those badges to our peoples. And then furthermore, with thinking about bioaccumulation and also the extent of radiation in our waters, you can imagine what this did for pregnant women who were, of course, using their own milk to feed their children or using water to mix the formulas. So the amount of uranium intake per person was over 100 times the federal maximum. And this is a quote from this article that states, "We washed our faces in it, we drank in it, we ate in it, it was sweet." And then the reason why this is so important is because at the same time, a new debilitating childhood condition emerged, which was called Navajo neurohepatopathy. It had an incredibly debilitating outcome for any child who was lucky to live past the age of 5. But this was called Navajo neurohepatopathy. And if you look at the scientific literature, it was actually one of blaming of us, that supposedly we had incestuous marriages. Supposedly that this was due to a population bottleneck, which is like, I'm going to say a whitewash term for genocidal events that had recently occurred to our peoples. But this language of neutrality was used to shift blame away from more obvious courses. And instead, people describe this as purely a genetic cause. And the concern here is that that genetic predetermination was used as a root cause rather than exploring more obvious and colonial factors. And this is incredibly important because every single time uranium prices fluctuate, as we're thinking about newer energy systems, we forget about this legacy and we rush more, again, to think about unearthing this metal. And now for me as a geneticist, when I was trained at Vanderbilt University, among other individuals who were very well entrenched in these computational methods, I heard over and over and over again, and I continue to hear, that if we want to ameliorate health disparities in our communities, we need more Indigenous participation in genomic studies. So this is actually amid over 25 plus years of efforts to get more Native Americans participating in research and clinical trials. And despite all of these efforts, we still constitute fewer than 1% of peoples. And I want to say here, first and foremost, it's not a matter of just getting us interested in research. It's a matter of shifting the status quo towards overcoming mistrust, prioritizing benefit sharing, and also empowering data decision equity. Now we are getting into this phase of moving away from understanding common variants contributing to a common disease, and we want to now look at rare variants that contribute to disease outcomes. And the search is going back towards US Indigenous peoples who have historically not participated in research. And I want to say that recruiting more Indigenous peoples is not going to solve this health equity problem. Giving us tests for free into our communities is not going to solve the health equity problem. And we have to think about the market system tied with innovation. When I stated that we started the Native Biodata Consortium, when we had our soft launch at the American Society of Human Genetics meeting, the largest professional gathering of human geneticists in the world, we had several drug companies asked to meet with us, and they had two questions. How many? What was your sample power? And across what phenotypes, what outcomes? And we came prepared with a list of conditions that primarily impacted our peoples, and we asked, why don't you use our people's DNA to study conditions that primarily impact us? And we were told, time and time again, you as Native peoples constitute less than 3% of the population. It is not profit generative for us to use your own DNA and data to study conditions that primarily impact you. This tells you everything you need to know about the term democratization, which I hate as a synonym for equity, because democracy, at least in this American system, is a system that benefits most and will continue to disenfranchise the few. And when we think about the background of other root causes of health inequities rooted in health, it's really more structural barriers related to preventative health. Before the pandemic, the amount of dollars per IHS patient, Indian Health Services patient, was 2.4 times less compared to the national per capita expenditure. After the pandemic, that disparity is even worse, 3.3 times more or less. And yet, time and time again, I hear federal officials, researchers, tell tribal nation leaders and community members, if you want your people to benefit from precision health and you don't want them to miss out, then you need to participate. And there's no attention to changing the very dynamics that created these research harms to begin with. This sounds like victim blaming. It sounds like coercion, because it is. And I gave a meeting, led a meeting at Cold Spring Harbor Laboratory last October, which is the largest convening of Indigenous academics and scientists at Cold Spring Harbor ever in history. And we invited a Navajo, a Diné woman surgeon general who has seen it. She has been through it. She understands the challenges. And she stated that genomics medicine will never be a benefit to our people, not amid all of these other barriers. Inadequate funding, the inattention of the US government to fulfill its treated promise to provide us adequate health care, poor infrastructures, lack of clean running water to wash our hands to curb viral transmission rates. You can imagine what that did at the start of the pandemic. Limited access to healthcare, and also questions related to impacts of colonization onto our lifestyles and those shifts onto health disparities. When we think about an Indigenous patient who might want to consider seeking a clinical genetic test, you have to understand that this is one at great economic cost. They have to hopefully have a working car, fuel, time off of work, somebody to take care of their kids. They have to be referred out to a specialty center, sometimes 3+ hours driving distance one way, hundreds of miles away. When they get there, what training exists for cultural competence care related to genomics medicine? Are people understanding that only a handful of medically actionable gene variants have information specific to Indigenous peoples? Is that information being conveyed back to Indigenous patients who may not have a variant on the test to be a benefit to them? What does this also mean for IHS patients and veterans through the VA who are not protected by the Genetic Information Non-Discrimination Act? When we think about this decision tree about whether or not to participate in clinical genetic testing, some patients may just say just no, they can't afford or access the test. Some might say yes, but they do not understand that this also means broadly consenting to any secondary data usage and data ownership by testing companies. And given the lack of relative benefit for just utilizing the tests, it feels like a catch-22. And I put a strong asterisk here because I know this is outside of the quality care that individual providers want to provide individual patients. But I want to say that these are systemic issues and they require shifts in the system if we want to ameliorate this. We are all complicit in some way in this system, and we all have the ability to change in our own ways to make this system of genomics medicine actually benefit all. This means calling to attention the fact that genetic testing companies can claim ownership to sequence data just by giving a test to a patient. That even if there's an opportunity to opt out of data sharing, that novel variants get deposited into public data sets like ClinVar. And then also, when you think about that patient being referred out to an urban tertiary care cancer center, they're also sometimes given the opportunity to participate in research studies, and they're given a consent to participate in research in the same stack that they're receiving consent to care forms. There are many papers that show that members of minoritized communities do not understand the difference, especially not when it's being informed by somebody who is wearing a white lab coat. So for those that don't understand about Native Americans, our 574 federally recognized nations in the US, that does not include 400 unrecognized ones, not including urban indigenous peoples. We had our own systems at clanship. The Navajo people, for instance, had over 200 different clans that acknowledged the heterogeneity of geographic origins for the peoples that we acquired in our lands and our communities. We have, for instance, Mexican peoples, we have Ute clan, we have Jemez Pueblo clan, et cetera, under this umbrella of a unified cultural identity. And it wasn't until 1934 that we get to the Wheeler-Howard Act that established the Indian Reorganization Act that established Native American as a legal category, distinct from how we used to recognize ourselves. And this brings me to a point that Native Americans or indigeneity is a political designation and less a racial ethnic one. And that is important, especially in these anti-DEI climates that we are now negotiating. But what does this mean for genetics? Or should I say eugenetics? We try to move away from our understanding of racially pure populations, but we still use and prefer least admixed populations in our studies. And then this is actually a map of one of the first large-scale diversity projects, the Human Genome Diversity Project, which represents really the global indigenous populations that exist to this date. If you notice something about the map, they are all outside the US. Mexico further south. People that have their own distinct cultural histories, their own distinct genetic histories, and yet they are used to infer genetically some statement about all US indigenous peoples. This doesn't make sense. And some of these populations, these reference groups, have as few as 30 individuals, compared to some reference groups that have tens of thousands of individuals. So for the lay audience, or most audiences, it can promote this conflated narrative of indigeneity as rooted in biology, something that we should be getting away from. I'm calling attention to this National Academy's paper report 2 summers ago that stated that researchers should not use race as a proxy for human genetic variation, that supports a pervasive misconception that humans can be grouped into discrete innate biological categories. And when we think about the system of recruitment and where this data comes from, In 2007, Larry Roter, another Larry, he went back to the Krystal, which is an Amazonian nation, and he basically asked, what was it that researchers promised you in exchange for your blood, your DNA? And they stated, we were promised therapeutics. We were promised medicines to be able to cure the afflictions that are ailing us. And so he had to say, well, now Coriel is selling your cell lines at like over $70 a vial. In the same article, these two quotes exist. One from a tribal leader, we were duped, lied to, and exploited. And from a lead NIH official, the scientific community is using these samples, which are accepted and maintained under perfectly legitimate procedures for the benefit of mankind. For the benefit of mankind, not to the benefit of the people that provided the DNA and the data that bring about the innovations. There is something wrong here. If we're talking about health inequities, health disparities, there's also here the inequity and disparity related to consent and also the ability to benefit from their own DNA. So if we're talking about phase 1, collecting DNA, and then somehow this future promise of will this actually benefit communities, I have asked researchers time and time again, what are you doing to ensure that your research is proximally benefiting the communities that you work with? And they have stated, well, we publish the studies, we publish the papers, it's up to somebody else to take on that last stretch. It's a huge question mark. And again, from a very basic equity standpoint, if Indigenous peoples are not benefiting from the sharing of their DNA, then who is? So this gets me to my point. Why is Indigenous genomic data sovereignty important? This is a definition that I have sort of circled around but haven't defined. So Indigenous data sovereignty is the ability of Indigenous nations to be able to self-direct, utilize their authority, agency, and autonomy to decide what happens to their data. And as applied to genomic data, this is something that I'm trying to champion and advocate for Indigenous nations to be able to operate within their own communities and their tribal lands. When we started the Native Biodata Consortium, we had this central promise that we want to provide an alternative for tribes to participate in research if they wanted to, and to have that data housed locally on their tribal lands in a space that they trust under tribal law. And what we also learned is we can get better research questions when we ask community members firsthand, what were the changes to your traditional lifestyles? And how do you see this contributing to conditions that are now afflicting your communities? And these research questions are far more advanced and far more nuanced than somebody that lives outside of their communities. And I think I've disparaged my fellow Gen Epi people enough. But I digress and continue to say that it is not enough to just take your pet phenotype as an outcome and throw on racial ethnicity covariates in a regression model and call it health disparities research. That is not enough. And if we want to build better research questions and do better research, it starts with the communities to ask the very questions that we're missing in the electronic health records, and also what we're missing across sequence data derived from whatever chip is or platform is in vogue. When we brought in Illumina sequencing technology, it was the first time in a rural tribal nation worldwide that had this type of sequencing power and capability on their lands. Just by having this ability locally meant that we, at the start of the pandemic, could return test results for SARS-CoV testing that used to take over 14 days because they had to be mailed out of state to then within 24 hours back to the community. You can imagine what that did to viral transmission rates, and also how cool it is to have a CLIA-certified laboratory right in a rural tribal setting. We've also been able to expand our knowledge of variants specific to rheumatoid arthritis, which heavily impacts the Lakota peoples. And we've also been able to expand our knowledge of wastewater-based epidemiology and approaches for COVID-19 surveillance and also expand our tribal public health law and resolutions. It turns out that when you have a data server and a data infrastructure on tribal lands that works under tribal policy and law, you get to do cool things. You don't have to be beholden to the same status quo or norms as larger institutions. We are smaller and more mobile, and we can also incorporate new changes in machine learning approaches such as blockchaining and federated learning and dynamic consent portals and metadata labeling. So if you know of this journal, Cell, and some of you may have heard of it, and you want to learn about how we can utilize blockchain to really uplift community members as authority nodes to decide who is able to access their data and be able to potentially block unconsented data transactions before they occur. This article goes into a little bit of that. If we want to talk about the inclusion of Indigenous peoples in algorithms and other outwardly held housed data, talk about using federated approaches for Indigenous data sovereignty as well. And then moving away from broad and blanket consent models and thinking more about adaptive or tiered consent processes or even dynamic consent processes. We can then give the participants the opportunity to decide what types of studies they are comfortable having their data contribute to. And it's also responsive to community level data governance processes as well. And they can change it too. You can also use this as like a public facing portal to expand education related towards questions that people have, like what is DNA, what is informed consent, what is this form that's being presented in front of me, etc. And people can actually see lay summaries of the studies in which their data has been used to help benefit. So hopefully improving transparency, promoting public trust, reducing that logistical burden of contact and recruitment. Turns out when we asked tribal elders what were their perspectives related to research, they stated that they actually saw that the benefit to data being held in their communities was more for the future generations. There is a teaching in some Anishinaabe cultures where it's the 7 grandfather teachings, where you think 7 generations forward. And for these people, for I'm not Anishinaabe, but for the culture that I was a guest in, they actually really first asked, how is the data going to be used to create job opportunities? And they rated that as a benefit even more than their own understanding related to their own individual diseases or conditions. They rated community benefit higher than individual benefit. And also, tribal nation members prefer to work with a nonprofit research organization compared to other entities. The NIH doesn't like it when I say that, though. All right, so in terms of building this next generation, I've been really fortunate with my colleague and friend, Dr. Matthew Anderson, who's Eastern Band of Cherokee descent, to start a workshop called Indigidata. So rather than asking community members to leave their communities to be trained, we bring the workshop directly to them. We've been able to direct 67% of our funds back into tribal nations communities. The only third that we're not able to funnel back in are things related to airlines and shuttles, which we don't own yet. But I think the Salt River Pima Maricopa Indian community is working on that, though. So we've been able to train over 85 Indigenous students across the different years in different spaces, thinking about topics related to the soil and the microbiome, biodiversity and biocollections, gene editing, food sovereignty, fisheries, waterways, eDNA. These are topics that are of interest to local communities. This year, we are holding this in Central Arizona on Indigenous health and AI. We had actually 150 applicants, so we had to expand the number of participants that we could take. In previous years, we have held workshops in the Pacific Northwest where people who do tribal fisheries management were really curious about utilizing metabarcode and qPCR for understanding more about the conservation of culturally relevant fish species like salmon, and how this relates to indigenous food sovereignties and foodways. Last year when we were in Salt River, we talked about building tech solutions for low resource workflows, being able to in field in really dusty desert hot conditions, this is June in Arizona, mind you, to be able to collect DNA from desert plants, sequence it, and then also we're working on being able to store this in conditions that don't require large amounts of ice so that we can ship it from a rule setting or allow tribal nations to store it locally. It turns out when you build a base of Indigenous data leaders and you think about expanding Indigenous policy and law and data governance, we're talking about expanding Indigenous data sovereignty. But once you start building data infrastructures and you start building digital data tools and potentially cloud solutions, we're thinking then about moving into an Indigenous digital sovereignty space. Among many of my projects, which include training Indigenous genetic counselors, I'm also so happy to be able to bring together all of my different levels of expertise, not only in genomics, but also in qualitative training, and start thinking about what are we missing when we're just focusing on DNA and EHR records. What about actually asking community members through validated surveys that are specific to their health behaviors, assessing them from the start with low missingness, high data quality, and then all things equal, having this information directly from participants with what we can assay from a chip plus whatever we can get from the EHR record, we can truly then start asking questions, what contributes most to health disparities? And we can also start thinking about expanding our understanding of population descriptors and labels and how we define populations by letting them define themselves. Thank you so much.
That was wonderful. Thank you. Questions, anybody?
Hi, thank you so much, Krystal. That was such a wonderful talk, and I learned so many things. I'm really curious about these consent portals and how you manage those. And just a thought that I had while you're presenting, if there's this problem with understanding what researchers are collecting and what they're doing, do these consent portals ever have something like a quiz where the participants could actually indicate their understanding and then talk about that with the researcher, like in the process of giving consent? And is this something that only you are using, or like other researchers might use? I could imagine using this in my research and having like a much better consent process than what I currently have, which is like a Google form or something.
No, thank you. Those are great questions. So first of all, I actually was inspired by the UK Biobank and dynamic consent electronic portals when we decided to design our consent portal. And we actually use solely philanthropic funds so that we could license this platform to other communities for free. So that is at a cost of over $1 million working with certain development companies. Also, thank you so much for the recommendation, Larry Hunter. So in terms of how this is working, we actually first start with either paper documents or red cap forms for patients, and we actually, or patient participants, and sit with them and have them understand step by step for as much time as they need in order to be able to understand the distinction and also how they can navigate this. The plan is also to incorporate training tools, modules, videos, so that they can self-navigate in the future. And then the plan is also to have a support tech team 24/7, so if anyone has questions, that they can also have somebody to be able to lean on for additional expertise. I hope that was all the questions, or most of them. Okay. We want to provide the opportunity for other tribal communities worldwide to be able to use it for themselves. As for other researchers who are interested in partnering with us, there is a way for them to actually navigate the data. An aggregate view, and this is again inspired by BioView, it came from Vanderbilt, and also be able to deposit all the different various research steps and documents and consent forms, et cetera, along with the project. Thanks.
Good. Krystal, that was wonderful. Thank you for bringing this to us. And I want to ask you to riff on a topic that you alluded to briefly, and I want you to expand on, which is, you identified 400 federally recognized tribes. That doesn't include Native Hawaiians. And furthermore, there's around the world, there's a tremendous collection of different indigenous peoples with different perspectives and needs. And I wondered if you would tell us a little bit about how you manage to both preserve the individual needs of particular communities and cooperate with and synergize with this diverse collection of folks around the world, and tell us a little bit about how that, the things that have worked well, maybe some things that are still in process and need work.
No, this is a common question that is brought up by individuals who are largely non-Indigenous, who would state, well, these individuals are both American citizens and tribal citizens. Shouldn't they also be able to participate in research studies? And it's usually phrased in, how do we navigate individual versus group consent? And to which I actually point them to a paper by Dr. Vanessa Haratzika, who's at the University of Alaska, or was University of Alaska of Anchorage, and now is at South Central Foundation. And they actually, their group did a democratic deliberation to include tribal elders, and one of them stated, it's not one or the other, it's both. And also, it's not up to outsider researchers to leverage those distinctions without communicating with the tribal nation in partnership. It's up to them to make those determinations. So when we as an organization decide to partner with research communities, it's always first at the community level first, only because we want to make sure that there are laws and policies and resolutions in place to protect them. And we actually spend a lot of time helping to bolster or suggest tribal laws and policies related to data sharing, data governance, et cetera, before research actually begins. And then, only then is it in partnership with communities, there might be recruitment with the actual community members. Our native bio is not really in a space where we actually initiate those relationships with tribal nations. We have enough requests from tribal nations that actually want to start at the nation level with us. And it's not always research oriented. Many organizations globally want to have either advice or consultation so that they could be able to make their own biobanks or repositories for themselves. Sometimes it's not even health oriented. Sometimes it's for like seed banking, for instance, or for the return or rematriation of samples back into a community for a study that has ended. But we mostly have served in an advisory consultation role, but some have also asked specifically for advice for them to be able to start their own organizations. And then for those tribal nations that are too small or it might be too logistically burdensome for them to navigate, they can also use us as a temporary steward.
Can you talk a little bit about education and maybe SIN?
SIN. Oh. So the summer internship for Indigenous peoples in genomics has been around since 2011. And I will say that it's a bit on hiatus at the moment. And I'll just leave it at that. Thank you. Is there another question up there? Oh. Yes.
Trying to frame my question into a comment. My dad was a student of Professor Wheat. He was over at, if I pronounce it correct, Hale Anthropology. And Professor Reed, before he passed away, my dad was kind of jokingly saying he had him down at Mesa Verde and he was measuring skulls and whatnot. And but he majored in geology. And anyways, Professor Gold, of course, is a member of the National Academy of Sciences, which I believe was started by President Lincoln, and Lincoln was a big advocate for the Native Americans. My dad chose a career in the CIA, and some of his best long-term contacts and friends over the years were the Montagnards, the Hmong in Vietnam. And so I was just wondering if you can incorporate what's going on, because it's kind of like a nation within a nation with the tribes and the reservations, something under the National Academy of Sciences to gather this information and to stronghold it, protect it, because that's kind of what I was getting from your presentation, that they're being taken advantage of, the data is being misused in one way or another, and of course the long-term effects of the Cold War, nuclear weapons, uranium mining, and the concentration of plutonium, et cetera. So my point is, do you see some central body and or organization acting on behalf of Native Americans to safeguard their genetic information? Thank you.
Usually that is, I'm going to try to rephrase my comment into a question, not the other way around. So I appreciate the question at the end. So first we have the National Congress of American Indians, which has been really fortunate for acting as our advocate on the Hill. And then increasingly, the National Institutes of Health, actually through their Tribal Health Research Office, has, for the past 2 years, had as its director, Dr. Karina Walters. And Dr. Walters is actually looking to create an NIH-wide Indigenous data sovereignty policy to also include a subsection for genomic data specifically. And that genomic data would also be not just encompassing within the health data space, but also for spaces related to paleogenomics and ancestor DNA. Thank you.
Thank you.
Hi, Krystal, thank you for this. I'm going to hit you up afterwards. I have a couple of statements that lead to a question. Excuse me. So one, I love the conversation that you had about who identifies you, whether you self-identify or if somebody quantifies and identifies you. I have conversations or thoughts about consent and how Indigenous people can benefit. Some notes that I had in your conversation, I think about like Ancestry.com, 23andMe. And so like, I have a question about like digital sovereignty. That was a term that I have, and like wondering your thoughts on like keeping that understanding of framework of the country that we live in and how that works and how to both internally and externally manage and maintain that.
Yes. So in the previous administration, there were a lot of moves towards moving toward the open data movement. And whereas the US nation can direct at a national level some of these shifts, there's actually the ability for each of the 574 federally recognized tribal nations to exercise their own authority to be able to self-direct how data that is collected on their tribal lands is utilized and collected. So one of the things that was an initial inquiry when we started our biobank is, are we restricting access to tribal data? And we actually stated no. We're providing an alternative for tribal nations that actually works for tribal nations. In the past, for instance, and I'm going to use dbGaP, the databases of genotypes and phenotypes as an example, it was just kind of like this de facto, if you accepted public funds through a grant, that data had to be deposited somewhere, ... Here's our dbGaP, consider depositing here. And there have been a lot of efforts to be able to incorporate Indigenous data governance on and befit it onto basically a colonial backbone, and it's always been very clunky. There weren't enough experts. The notion that anytime a meeting in Bethesda, Maryland was going to be held, that tribal nations leaders from like rural North Dakota would willingly drive 3 hours one way and then have an 8-hour flight one way and then back and forth quarterly, and taking them away from their core constituents and their core community members is just didn't quite sit well with tribal nation leaders and members. So we just stated, well, why don't we make a solution where the then tribal nations can actually determine who are they most comfortable partnering with. So we were successful, and then there was it's now dissolved with the current administration, but at the height of the pandemic, there was a series of programs called RADx Up, the Rapid Acceleration Diagnostics in Underrepresented Populations. And there was sort of an incentive for tribal nations to participate in RADx Up. And then at the end of this initial program period, the NIH stated, well, now we have all this tribal data. Why don't we create a federal data repository? And so they did a call, and now we, as the similar partners that run the Native Biodata Consortium, I and other Indigenous scientists are now leading that effort. It's called D4I, Data for Indigenous Innovations, Implementations, and Interventions, Tribal Data Repository, and that's specific for federally funded research. And that's distinct from Native Bio, which is one that is a little bit more grassroots with a wider heterogeneity of research questions and data types. So hopefully there's an answer in there for you. All right.
Okay, one last question, please.
I feel moved to thank you for such a thoughtful, eloquent, articulate, helpful, valuable, respectful tribute to the past and to the future and to people. And I can only hope and wish that more of this world could be in your hands.
Thank you. Thank you. To that, I'll say that Indigenous scientists and data scientists have predated most universities. So when we think about modern genetics, starting with Mendel, I say, look to your refrigerator. If there's an ear of corn there, if you have aspirin in your fridge, you know you've seen Indigenous science in the works. And if you know anything about the Polynesian Moa stones, which was sort of a non-digital ledger system, then you can also notice that we were utilizing a type of a database management in a sense as well. So thank you all.